materials. Um, Also procurement as a gatekeeper slash gateway to integrate more of these bio-based solutions within the humanitarian supply chain, and the use of less polluting waste treatment and waste management methods. So trying to make the waste management, the disposal part of the supply chain a little bit more efficient. And then, of course, the livelihoods of the waste pickers, as well as then policy development and advocacy. So this is just a quick overview of our consortium. We had 10 main partners and then several associated partners. So Finland, we had two, Hanken School of Economics, the Humlag Institute was the coordinator, and then we had the Finnish Red Cross. And then um, we also had the Vietnamese Red Cross and RMIT, which is a university in Ho Chi Minh City, were our partners as well from Vietnam. So that's what, and then we had Pamela Steele Associates from Kenya. So our main focus contexts were Vietnam and Kenya because of the presence of these partners. So I would like to just share a couple of results. I won't share them all. I'll share the ones that I thought might be most interesting and the ones that are maybe the most recent. So we had local awareness campaigns in both Kenya and Vietnam. So this one is there were several different kinds of activities that were done in both countries. So, but both had the goal of engaging local communities as well as then healthcare facilities within those communities on safe, hygienic, and environmentally friendly or sound waste handling practices. Just raising awareness and educating not just the healthcare facility, but people in general who use those services, and very much emphasizing alternative waste treatment and waste management methods. And yeah, so our purposes were to raise community understanding, promote sustainable behaviors, particularly by engaging with young people, with children and teenagers, and then empower communities, particularly with the waste picking social component that we had through creative expression as well, and then just to get people interested in how waste is actually managed. And then, of course, we had practical guidance, and we also spoke with a lot of healthcare facilities in both countries, and as well as waste management facilities to just kind of see how things are done. This slide has a lot of text on it, but this was the awareness campaign in Vietnam, where, yeah, so the goals were very similar: raise community awareness, strengthen the connection between the communities as well as the waste collectors. So in Vietnam, the focus was a lot more on the community and waste picking and how community efforts can come together and have a positive impact on waste management and reduction of waste. Yeah, and we had several different workshops, both in Vietnam and in Kenya, with people involved in waste picking and as well as then healthcare facilities and humanitarian organizations. And we really had some great experiences with our partners and collaborators in both of the countries. Yeah, so we felt that we really did raise awareness among residents as well as healthcare staff. And we did talk quite a bit about the risks of open burning, in like improper incineration, and then practical, safer treatment alternatives. There was, I personally attended an event at a school in Kenya where we watched, for example, a play about incinerating and healthcare waste, which was the best play I ever saw. And then we really tried to foster these cross-sectoral partnerships with healthcare people, with the community, with policy workers, with local government, even sometimes federal government as well as then the humanitarian organizations and NGOs that work alongside people. And yeah, so and then the behavior of the healthcare facility level, we also felt like we did influence somewhat. Then this is a little bit I just wanted to show you the causal loop diagrams that we built. So this is regarding technical performance of bio-based materials. So just this is just I won't go through the whole thing because that would take forever. But we did a couple of these, so I'm just going to show you some examples. So we have the technical performance, and then we have the waste management alternative causal loop diagram. But yeah, I'll go. So here, based on these causal loop diagrams and the analysis that we did, we found some limitations towards bio-based solutions within particularly the humanitarian context, and particularly the healthcare element is always there. So here are the environmental benefits. So the bio-based materials they possibly can reduce greenhouse gas emissions. They reduce dependence on fossil resources, and they can also reduce the total waste generated because you can biodegrade them or recycle them easier. And then these can have long-term effects on the humanitarian sector as well as all the other sectors. Some of the challenges, particularly within the healthcare context, is their lack of durability and conventional hygiene implications and specifics, because the medical setting and healthcare setting is extremely strict on both of these. So sometimes these at the moment can still be a bit of an issue, as well as they can sometimes the price to quality ratio might not be quite what we are used to with fossil fuel based materials. And then, yeah, this one is a little bit controversial in a way because it might then have an impact on the informal waste sector. Switching to bio-based materials might disrupt urban informal recycling economies and waste picker livelihoods. But yeah, this one I feel like is a completely different can of worms. But I feel like if you look at the durability and hygiene, I think those are the issues that we should focus on the most. And then so if these bio-based materials are adopted in a thoughtful and well-researched manner, they can absolutely support environmental and social goals within the humanitarian sector, and kind of foster inclusive policies and improved waste infrastructure for both social, economic, and environmental sustainability, as well as then paired with operational needs. So then when we look at a little bit about the sustainable livelihoods among the waste pickers, so what we achieved there. So we mapped existing programs and projects, which was a very interesting exercise. So from end users, meaning our humanitarian partners, we discussed what kind of programs they have, what kind of programs they feel like they might need as well as then looking at gray literature that already exists, so reports and different kinds of publications from non-academic sources, so from the humanitarian NGO community. We did several site visits with local waste management and livelihood organizations in both Kenya and Vietnam. Personally, for example, I visited a waste management plant in Nairobi, which was super interesting. As well as then we had the external stakeholder workshops, which I think somebody from Bio4HUMAN also attended, at least in Nairobi. And so we had one in Kenya and one in Vietnam. And then we were able to secure some interviews with informal waste pickers as well. One of our biggest or like one of our most kind of concrete achievements were the standard operating procedures for waste management in field hospital context. So we formulated two standardized standard operating procedures covering material and waste life cycles for emergency medical teams, as well as field hospitals in general. We very much integrated circular economy principles into these SOPs, as well, which then translate into more circularity within humanitarian logistics and particularly in the emergency medical team operations. And we have very practical, and the SOPs contain practical tools for waste segregation, tracking, and donation documentation, because the field hospitals usually work with a donation principle. So Finland, the Finnish Red Cross, for example, deploys the field hospital, and it is not shipped back to Finland. It stays with the local, usually the National Society of the Red Cross, but the local or the Ministry of Health or somehow. So we had the two SOPs were just general waste management within the operation and deployment, as well as then the donation handover. So what kind of rules and regulations, as well as then ensuring that some of the waste management practices adopted continue with when the responsibility changes. We collaborated very strongly with several of our humanitarian partners, as well as partners in Kenya and Vietnam. We had great contacts with, for example, WHO emergency medical team management. So this was a very, very interesting and fulfilling exercise as well. There are some contributions to global policy as well. The WHO emergency medical team has been involved, and they have been implementing some of the suggestions that we made in our SOPs, which are available on our website, by the way. And yeah, this was all done very evidence-based on a very evidence-based principle. So we used existing SOPs already, had some workshops, spoke to plenty of EMT operators, as well as deployed EMTs, as well as then some observations with the Finnish Red Cross with their field hospital projects. So that was a very quick and dirty overview of what we've achieved with Worm. It's been a real pleasure working with Bio4Human. I hope we can stay in touch, maybe future projects and collaborations. But yeah, if you have any comments or questions, feel free to either email me, or I think we don't have time for that now, but yeah, please visit our website, see some of our deliverables. The website is, wormproject.eu. We also have our LinkedIn should still be up and running as well, so there's quite a lot of updates there. And we have, for example, a YouTube series of all of our researchers and partners being interviewed. So if this tickled your fancy, please do stay in touch.
Thank you very much, Virva, for your time, and safe travels.
Thank you.
Yes, great. So before we jump into the coffee session, I just wanted to ask if we have any questions in the room for our panelists that you would like to raise, or any type of observation. I think we have still space for one or two questions, or grab them during the coffee break also. So any question that we have? Yes, Nello.
Hello. Yeah, I'm Joel Songambele Luamba. Hello?
Yes, we can hear you, and then we take a
Can you hear me
question from the room. Yes, go ahead.
I'm Joel Songambele Luamba. I'm the program assistant of SADI, Integral Support Development Organization, that is based in DRC Goma. And the SADI was funded by European Union for the project of biodegradable waste to transform sustainable energy for household cooking. Then I heard from the presentation, I heard when she was Peru was trying to explaining the impact that they had from the project that they made in Kenya and in Vietnam about the waste management. Then I would like to know if how I heard the aspect of a circular economy. How did they do to ensure that the beneficiaries are producing, are using the waste to make money for their sustainability? That is my question.
Yes, so this is a question to Virva. I'm not sure you're still here. Yes, good. Sorry. Yes, go ahead.
Yeah, hi. Thank you for your question. So as I said earlier, our project was more about implementing guidelines and policies and doing like background research on that. So unfortunately, we didn't have uh, the opportunity to do a longer term study as where we could follow some of these policies and some of the research that we did for a longer period of time, which was, of course, the dream, where we would really want to dig deeper into the waste picker element and the fact that they were actually able to that they would have been able to monetize the or like better monetize. But I feel like our research uh, contributes to the fact or to policies regarding waste pickers and that they are an important part of society as well as performing an extremely important task within the waste management um, uh, function. So that was our goal, and I think we achieved some of that as well. And I think now it's more up to the organizations that we were working with to make sure that these policies are more implemented and that the waste pickers are treated fairly and um, get the credit that they deserve from the extremely important work that they're doing. I hope this answered your question at least a little bit. If you want, you please email me and I can we can have a proper discussion. And I think now is more Bio4HUMAN's
Yeah.
time to shine.
Thank you. I would like to give floor for Nello Emerencia from Bio-Based Industries Consortium.
Thank you. The results that you presented are significant and with a potentially huge impact, as I hear them. And they are not only applicable in humanitarian settings, but in every sector, and everywhere where we are trying to get bio-based solutions accepted and scaled up. My question now is, what's next? How can we keep this project, its results, alive and be taken up and scaled up, etc.? I think that we're facing the same question with every single project. But this is so significant. It would be a tremendous waste, and we hate the word waste, but you know, it would be a waste of your effort, etc. If it now disappears in some sort of a drawer and nobody cares about it. There are many stakeholders. You mentioned all of them. And my experience is that if you have many fathers of successes and you expect one of them to take the lead, no one does. So my question to you is, from your perspective, who would be the best stakeholder that you could charge with to take on the lead for the next steps? Who would be the best? That's my simple question.
So maybe I would give the floor for our humanitarian partners, and then I can jump in from the project side in general. Go ahead.
Yeah,
Maria.
thanks. I think we will be discussing more this in the session 3, right?
Yes.
Which is all about scaling up and who will be doing this. So this will be discussed. From my point of view, we focus heavily, even in the replication roadmap, on the humanitarian organizations who are working in the humanitarian context. So I think the opportunities are really there. The donors want it. They are willing to fund it. The policies are there. We have the data, what's needed. So I think that's definitely at least our responsibility, and we are trying to change this to start from there. And as you said, to work with all the stakeholders there are in the context we work in, because there are a lot of them, like local enterprises, businesses that are willing, and they are already doing great work. We just need to work more together and maybe change the modalities we work. So try to implement more business-oriented action. Don't be afraid to even, put part of our budgets for the businesses or for different models of operations. Yeah, we can discuss it for hours, but I will stop there. Yeah.
Anyone wants to add? Yeah, anyone?
No, I mean, I agree with Mari, but it's a hard question because there is no one stakeholder that can really take it further, because as we saw, it has so many layers, and also each context will be different. So even with humanitarian organizations, take it further, still they need a lot of support from other actors. So I think there is a lot of potential there, but it's not like easy win that we will point, you take it and you do something with it. But personally, I can see that even within this consortium, we already, like we discussed with Pina as well, that we already have some steps internally in our organizations to build on this exercise. So, yeah.
Yeah. I would maybe just add from the coordinator eyes that having that multi-actor cooperations is, I think, fruitful, and it would be nice to see that there are more than 2 projects, and this chain of work really very much continues. I think like all these partners, we have learned so much from each other in this project. And I also wanted to commend this team that is here for panel session 1, but also for all the sessions. It's not easy to speak the language of other actor, and they have learned it well in the project. But there are millions of others who need to go through similar exercise. So I think they are the best now to learn from, and it would be nice to see like more projects like this coming into the pipeline within different types of funding that have the opportunity what they had in the last 2.5 years. So yeah, good. I think yes, we have one more question, and then let's kick off the coffee.
Hello, Marco De Vetta, representing Sogesca, environmental engineering company from Italy, Padova. Sorry for standing between you and the coffee break. But I had just one quick question about the life cycle assessment. You compared the fossil fuel materials versus the bio-based materials. And of course, the bio-based materials have an end-of-life impact of nearly 0, while the fossil fuel-based have a 35% or something impact. But considering the context where you bring those materials, how realistic is that? How far are we from getting to that really real 0 impact on end of life?
Yeah, this is a challenge. Indeed, here we kind of assess the best case scenario where we have something to compost the product in, like home compost or industrial composting, depending on the material. Here in this case, it was home composting, so with really low impact. Indeed, what we have assessed is that if this is mismanaged and if the waste ends up in open dump or open burning, the impacts at end of life would be similar to the fossil-based material, which is also open dump. So what we've learned from this is that the main issue is, yes, to implement the solid waste management initiatives and to start with waste sorting and everything, and also like identify clearly which material are bio-based and biodegradable, most importantly, so that we can ensure that these efforts are actually useful and yeah. I guess that's what I can say.
Great. Yes.
I just want to add that we have very specific countries here that we used. So, if we think that solid waste management is the most important part, those 2 contexts have very limited at the moment capacity to have the impact from bio-based solutions. But when we talk more about humanitarian context, this kind of, let's say, conflict or catastrophes, they are happening around the world. So then depending on the country that we will be working in, the end of life varies so vast that I can see huge potential here. Just depending on the end of life in certain country. Yeah.
Great. Thank you. So not to start rolling on the delay, I would like to welcome the participants in the room to go and take some coffee. And I think we can reconvene within, let me check it, within 10-15 minutes.